A federal law requires hospitals to stabilize all patients that walk into emergency rooms, whether or not they have health insurance. But when those patients are unable to pay, who becomes responsible for the costs? ABC 7's Erica Jackson joins us now to share who is actually paying the bills. Erica.
Alan, thank you. A 2015 study shows every ER visit by an uninsured patient leads to $900 in uncompensated costs. Some of that falls on the hospital, and it may also fall on you.
The middle class is one emergency away from being bankrupt.
Debbie Coyne doesn't ask for much out of life. She just wants good health with no medical surprises.
It should not happen in 2018 that anybody's denied health care.
So what happens when the uninsured and poverty-stricken Americans go to the hospital and can't pay the bill? Hospitals front the cost.
People are actually going to ERs for treatment nowadays because of the big problems with health insurance.
Sarasota Memorial Hospital says it fronted more than $100 million in safety net care costs in the 2017 fiscal year. $16 million of that covered 24-hour specialty care for trauma and emergency room patients, and nearly $10 million for indigent adults not eligible for health care coverage. Some aren't convinced hospitals are always responsible for the bill.
It's been determined that medical care is a for-profit business instead of having a commitment to really taking care of our citizens and taking care of the community.
The people who end up paying for those who cannot or will not pay their bills or do not have insurance falls on the health care people who do pay for it or the taxpayers through the government.
Many of the 28.2 million uninsured Americans under 65 don't want that bill to fall on anyone else. Coyne falls in that category. She says her family's income is too high to qualify for Obamacare, but can't afford the premiums charged by private insurance companies. So the family avoids hospital visits at all cost.
You have that fear of, if I go, I'm going to have thousands and thousands and $1,000s in debt.
She's dealing with the repercussions of living in America without health care coverage. Coyne was rushed to Blake Medical Center in August, and 1 year later, she's still struggling to pay off her $2,000 bill for just seeing a doctor and getting an electrocardiogram.
I do believe it is, the middle class that's fallen through the cracks.
The latest data from the CDC shows the number of emergency visits reached an all-time high in 2014, with 141 million patients visiting the ER the year Obamacare's insurance expansion went into effect.
It doesn't matter if they're poor or rich, what race they are, where they're from, if they're here legally or illegally. You cannot tell them, go out on the street and die, and we're not gonna take care of you.
Emergency rooms are required to stabilize patients, whether insured or not, under the Emergency Medical Treatment and Labor Act.
They're not required to treat them, they're required to stabilize them.
They can't go to a regular doctor and make that appointment, and because you can be turned down from a doctor's appointment, but you can't at the ER.
A 2016 study by the National Bureau of Economic Research reports an uninsured person who will go to the hospital this year doubles their chance of filing for bankruptcy by 2022. Coyne wants America to find a better solution for health care, so she doesn't become another statistic.
Every day we say lots of prayers.
Only a portion of Americans are living without health insurance. The CDC reports nearly 70% of adults under 65 are covered by a private health insurance agency. 12% are uninsured, with 20% of Americans covered by public insurance.
Erica, thank you.